Okay, we are live. Good evening, everybody. Welcome to another episode on the show, Behind the Scenes Hell with Dr. Rod. And on today's episode, we have an interesting guest in the house. He's a physiotherapist, he's a medic, and I'll leave him to introduce himself. So, Adebola, over to you. Can we get to meet you?
Yeah, hello guys. My name is Adebola Badiru. I'm a first contact musculoskeletal specialist, physiotherapist in the UK with nearly 10 years of a clinical experience. Um, um, well, I'm triple licensed when you exclude Nigeria, in the sense that I'm licensed to practice physiotherapy in the UK, in New Zealand, and in Australia. And I'm happy to be here today with Dr. Ron.
That's quite an interesting profile. Anyway, we'll still get to the nitty gritty of that. I mean, I had to bring him on because everybody's asking when are you going to bring a physiotherapist, and here we are today. And thank you, Adebola, for giving us some of your precious time. So, I mean, I like starting from the backstory before we get to the front of the conversation, right? And so, I mean, at what point did you decide you were going to move, or you wanted to move to the UK to practice physiotherapy?
Thank you very much. Well, the choice to move to the UK, it's a very funny one actually. It's something I don't like talking about all the time, but what really happened, honestly, what happened was I like to tell people that I had a very wonderful job in Nigeria. I loved my job, but nobody should ask me what the job was. And it paid well, but and I was a bit stubborn about leaving the country until the train attack happened, the one that involved kidnapping of so many Nigerians in
Yeah.
Kaduna, from Abuja to Kaduna. Yeah, and my wife and kid were supposed to be on that train. That train
Wow.
actually, what happened was the Uber that was supposed to take them had a problem, so they couldn't go to the train station at that. So they had to shift to the next day.
Yeah.
Yeah, so she had problem getting an Uber, so she canceled. She already bought a ticket online, and so she canceled and shifted it to the next day. So when I heard about the train attack, I was in Lagos then, and I heard about the attack. I was it was something else because my impression was that they were on that train. So
Yeah.
I almost ran mad. So I think it was that day I made up my mind I was going to leave Nigeria, and 3 months later I was outside the country.
Oh, that was quite fast. I mean, so because I know for a lot of persons who tend to leave, there is usually this turning point at, I mean, the when they reach the elastic limit, like I can't stay again. I just need to, go. And I'm happy your wife and kid are fine. So, looking at how you were able to move, I know people move through different routes. People go through the school method, MSc, continue working, or those who come in through HCA route, or they get a direct job in the UK in whatever profession they are doing. So, which of those pathways did you use?
Well, for me, it was I never thought about the study route. It never crossed my mind. I always
Okay.
thought, as a clinician, I always knew that we were sought after s- outside the country. So for me, when I made up my mind about leaving the country, what I just thought about was how do I go? Which country would it be easy for me to migrate to, and which
Hmm.
and so I just thought about it, and I moved. I think when I decided to go, I started the whole process. Eventually, I ended up getting two jobs at the same time,
Interesting.
one to New Zealand and one to Australia. So it became a problem of making a choice of which to move to.
Yeah.
Yeah,
So, I mean, okay, apparently the UK was the, easier option for you to, choose and move to. So, in terms
yeah.
of that actual transition, what were the challenges you faced? A lot of people, like for doctors like us, you're looking at lots of money, booking flights and all of that. I mean, what were the core challenges that you faced?
Well, for let me start with that of New Zealand. Um, when I when I decided to leave the country, I
Hmm.
think I'd already gotten my UK license and everything, and then I started looking for a job. So at this in December 2022.
Okay.
The New Zealand government created a new pathway called the Express Pathway for physiotherapists who could, well, or who studied in Australia, Canada, Ireland, UK, to move to New Zealand. So the express pathway meant that they didn't have to go through the rigor of going through the general pathway and writing exams and all that. So what happened, and then people who were also licensed to practice in those countries too would also go through the pathway. So because I
Okay.
was licensed to practice in UK, I'd gotten my license. Then what I did was I did what was known as a cold email. So I went on the web and decided to search for physiotherapy clinics in New Zealand.
Okay.
So I kept on searching. I think I got about 50 clinics that were
Okay.
practicing in New Zealand. I didn't know what provinces or states they belong to. I just knew that I needed physiotherapy clinics in New Zealand. And then I began to send message to all of them one after the other.
Wow.
Hello, cold email style. So cold email is basically an email you send to somebody who isn't expecting it. So I sent the mail. Hello, my name is Adebola Badiru. I'm a physiotherapist in Nigeria. I'm licensed to practice in the UK, and I'm eligible for the express pathway, which meant I could get my license within 2 weeks if you give me a job.
Yeah.
Attached below is my CV, blah 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 blah. I'm
Okay.
keen in it. I'm an MSK physio and stuff like that. And I kept on sending these messages over and over. I think it was towards the festive period. So I just kept on sending everything like that. So I didn't get any reply from them till I think early January, and then messages started coming in one after the other. Some would say, "Oh, we're sorry, we can't give you the job. We prefer
Mm-hmm.
someone who was already in New Zealand." And then I got two. One later cancelled, and then one of them was what the hospital did was they transferred me to their recruitment agency, which is
Okay.
Kinetics or so. And then they booked an interview with me. I did the interview, and they gave me the job. So they they were ready to pay for my license and all that for me to just come. They knew about the process. Just said, look, we're going to pay for your license. Just come over.
Mm-hmm.
Um, but at that point, I got my UK job at the same time. So now talking about the UK, when I decided to move to the UK, what I did was I just got my HCPC license. To get the HCPC license, something that every physiotherapist in Nigeria knows about right now because it's so popular.
Popular,
Get your
right?
Yes, it's so popular. All you need to just get your credentials, send them over for evaluation. You don't have to write IELTS. You could send them a letter from your school that
Okay.
says you were taught in English language, and this is
English.
unique to people professions regulated under the XCPC. They're talking about audiologists, speech therapists, physiotherapists, radiographers, unlike doctors and nurses where they have to write IELTS first. Although this is changing in January because the HCPC says they've been having problems with people who can't speak English in the NHS
Ah,
trust, and yeah,
wow.
so that's really a problem. So they want everybody to start writing,
IELTS.
yeah, IELTS
Wow.
or TOEFL before they can move to the UK. So I think
Getting.
this is going to change probably at the end of January this year. And that's why I keep telling people who want to move to UK to quickly do so as get their license as soon as possible because it's although IELTS is becoming easier to pass now, especially with the new system in place where you can combine results and all that, or you can rewrite. But if you don't want to write the exams, it's the best time to just do that. So back to the XCPC story. I think what I did was I got my license, I did it, I sent everything, and I think it took me 1 month and 10 days to get my license, to get a feedback from the Health and Care Professions Council (XCPC)
Okay.
saying that congratulations, I could register with the board. My qualifications have been evaluated and assessed, and I meet the standard of proficiency. So what
Okay.
I did was I paid, got my license, and then I started looking for the job. And the luck I did have, and I say luck, I said I was lucky because I knew a lot of people who they got their license and they've been applying for jobs for 1 year and they haven't gotten anything. They do
Wow.
sometimes they get jobs and they get interviews rather, and then they don't succeed during the interviews. But with me, my first application, I got a job, I got an interview, and I got a job.
Wow.
Yeah, so 3 months I was outside Nigeria, and they were so
That's
quick because
amazing.
it was, yes, it was so quick because the GP surgeries I was supposed to be working in were really, really desperate for me to resume as soon as possible. So my COS came out within 3 days.
Wow.
Yeah, so I just moved to the UK, and I think that was when I had this challenge of where to move to, New Zealand or Australia. And I think one of the key factors that made it that determined which country I moved to was distance. 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 It takes you if you're going by a direct flight, which doesn't exist. There's no direct flight to New Zealand. But
Yeah.
if you're going by a direct flight to New Zealand, it takes you about 24 hours, 26 hours or so to get there.
It's a whole day.
It's a whole day, and there's no direct flight. Sometimes you take flights that has three stops. Sometimes you have layovers that will last you for. uh, my sister is there, and it took her 3 days to get there. So we kept on calling. Have you gotten there? Have you
Wow.
gotten there? It wasn't. And then you look at we keep complaining of Nigerians. But the truth is that we need Nigerians to survive. The UK has Nigerians. Let me come to where my people are. So
Where you have a lot of people, Abby.
let me come to UK where my people are. So I came to the UK, and so when I later arrived, I later decided to just get the express pathway and get my New Zealand license once and for all.
Interesting. You also mentioned that you've also got the Australian license. How did that, come about?
Okay, for the Australian license, what happened was I've been advising people and coaching people about how to get migrate to Australia. So
Mhm.
you can't. I don't think it's proper for you to tell someone to go through. Oh, look at this process. Look at this process online. You just try and it will work for you. It doesn't
Yeah.
make any sense. If you've not gone through the process yourself and you don't know what's there, how would you tell people to go through the process? So there's this agreement between the New Zealand government and the Australian government because, of course, they're very close to each other. So they call it the Trans-Tasmanian Agreement, which allows people who are licensed to work in Australia to work in New Zealand, those who are licensed to work in New Zealand to work in Australia. So because I had gotten my New Zealand license, I simply had to pay for my AFRA and my APC. I just got my license to practice in Australia. It wasn't even hard at all. I think it took me about 2 weeks. I just paid for it and
Hmm.
got it. Although there's a pathway for those who don't have the UK license and don't have the New Zealand license to get Australian license. What Australia does is that it gives you a temporary license. Once you send your credentials and you take the competency exam online, which is you could do online, it gives you a
Yeah.
temporary license. The temporary license lasts for 2 years. So within that two
Wow.
years, you could use that license to get a job in Australia and migrate to Australia to work, but under supervision as a physio. So you'll be
Oh,
working under supervision while you write your exams and your written exams and then clinical exams. So
so
that's
basically,
one. Yeah.
okay. So basically, you have maybe like 2 years to pass your exams and get a permanent license.
Yes, yes, yes. But you work under supervision. So some
Supervision.
some employers might not want to take you because the fact that you are working under supervision to them, they might
Hmm.
want someone who can work without being supervised. But
Yeah.
if that's one way that Nigerians could use as well to migrate to Australia if you don't have the New Zealand license and the um UK license. Because when you think about it now, getting the new Australian license, what that means is that you'd have to go through UK, spend a lot of money,
Hmm.
then get the New Zealand license, which costs a lot of money, then get the Australian license, which costs a lot of money as well. So by the time you look at it, that's a whole lot of money. If you can afford it, just go through. If you don't want to, if you can afford it, go through the pathway. But if you cannot afford it, the general pathway for Australia is still there, which is also okay.
Okay. So anybody
Yeah.
can explore whatever option that suits them.
What about option? New Zealand as well also has the general pathway. However, it does take up to 6 months for
Wow,
you
that's a long
to.
time.
And I won't even advise anybody to go through the general pathway if you're being honest, except you don't have the HCPC and you don't want to go through the stress. But I think HCPC is quite easy to get. Once you have your credentials, you send it, you get your license, you have the money, pay. pay for the New Zealand license, and then you go.
Okay, that's cool. So if you're a physiotherapist who is watching, you've gotten the, maybe you haven't heard, but you just share the information on how you can, quickly get yourself licensed and move there as a physiotherapist. Now, looking at what you're currently doing in the UK, I mean, you've worked in Nigeria for over a decade, you've moved to the UK. Are there differences in the healthcare system, different practices from a physio perspective?
Well, of course, there's several differences. So many, so many. I mean, okay, let me use the field in which I work as a physio. As a first contact physio, this role does not exist in Nigeria. Doesn't
Uh,
exist.
okay.
It's something that they are trying to establish, but doesn't exist. And I don't think it's going to be established in Nigeria anytime soon. So yeah, there are so many differences clinically when you think of the practice. Um, and what how would I say this? When I came to the UK at first,
Yeah.
I know something now. I'm good. I'm good. Well, when I the day I shadowed, when I saw what they were doing, I'm like, what am I here to do?
Mm.
But, but what happened was I developed myself, and
Okay.
I will tell any physiotherapist that is moving to the UK, if you want to practice and you want to be good at your job, spend money, spend time, read. And when I say spend money, subscribe to physiotherapy learning channels or
Okay.
learning platforms, where you learn various clinical knowledge, and you get clinical knowledge and clinical skills that would make you get to that level of those in the UK. Because, and this is not a shade to Nigerian physiotherapy practice, but what we have here, and especially MSK, it's
Yeah.
different. And this is coming from a physio who has practiced in Nigeria. It's different. Now, I'm not shading Nigerian physiotherapy practice. Hands-on, we're very good, but these guys are good when it comes to assessment, and the practice is different. The practice is different. But but if you know what you're doing, you because like I said, the theory aspect is in Nigeria. So if you know what you're doing, you would come in, you settle down, you adjust, and you excel. Nigerians are very good at adapting to various places they find themselves.
Yeah. So in terms
Yeah.
of adaptation, how long would you say it took you to, like, be comfortable to be able to, work effectively or efficiently in the system?
No, I would say it took me roughly. I'm still adapting. If you're being honest, I'm still
Yeah.
adapting.
Okay.
But I would say it took me 3 months.
3 months. Okay.
It took me 3 months to be able to, okay, navigate my way, learn when to give a patient a fit note, for instance, or a sick note, learn how to, should I say, um, engage patients in shared decision making,
Hmm.
um, you know, personalized care plan, which we do say we do in Nigeria, but it's different how they do it here. You know, what when I talk of shared decision making, let's think about it this way. Patient has osteoarthritis, you diagnose the
Yeah.
patient of osteoarthritis in Nigeria, and most physiotherapists, I'm not going to say any, some physiotherapists would say, okay, take these exercises, do this, do that, and then the patient is happy. It's similar to how doctors would say, take this medication when you have malaria, do this and do that, and go home.
Absolutely.
But
Yeah.
here, you would ask the patient, this and this and this are the treatment guidelines we have for this condition. These are the conservative management we have for this condition. This is the medical treatment. This is surgical treatment. Which do you think you would want? And these are the various side effects or the various
Pros and
advantages
cons.
that yes, the pros and cons exactly that each treatment will give you, and the patients decide what they want. You don't tell the if the patient, even if you think this treatment strategy is going to be better for this patient, the patient tells you they don't want it. There's nothing you can do. I
Mm.
think I had a patient who had osteoporosis the other day, and she had arthritis in the shoulder also, and she wanted corticosteroid injections. And I told her, look, this is good for you. This would help with your pains, but the fact that I have osteoporosis, it's really
Yeah.
not good for you. But she said she wanted it. And what could I do? What could I say? I just booked her in to see the GP to give her the steroid injections. There's nothing I could do.
Mm-hmm.
So it comes down, and this is something that we really do lack in Nigeria as well. Another aspect in which I've noticed again is making every decision, every contact counts. MEC, something we
Yeah.
don't practice in Nigeria. When you see a patient who, for instance, smokes, and the patient keeps having maybe tendinitis, for instance, let's say Achilles tendinitis, and smoking would affect the tendons, the integrity of the tendons. Even if the patient didn't have this condition, or the smoking won't affect this condition, every time you see a patient as a physio, you try to make that contact you had with that patient to count. And how do you do that? You simply ask the patient, look, would you like to stop smoking? Or what's your opinion about smoking? And
Mm-hmm.
and then the patient will tell you, oh, I would love to stop smoking. I think smoking is bad for me, but I've tried stopping to smoke. I've not been able to stop. Or patient will simply tell you, nope, I don't want to stop smoking. I love smoking. Uh, I mean, Nigeria, what we do is, consign me now. You are smoking or no smoking. I think consign me. It's your business now. So, so it's something that I've had to put myself in. I've had to learn all this, unlearn some of the things I've learned in Nigeria, and relearn and retrain myself.
Mm-hmm.
And it's been a fun ride.
And you probably say that's like sort of increase your confidence levels, really.
100%, 100%. It has. I always keep telling myself, I wonder if I go back to Nigeria to practice. When I go back to Nigeria to practice, how would I practice? That confidence, I can't wait to go back to Nigeria. I can't wait.
How soon are you going back to Nigeria?
Not soon, oh, not soon. Oh. In the future, you go back, but in the future, not anytime soon.
I
Not
mean,
anytime soon.
looking at all the things you're learning, the new practices or best practices. I mean, you probably should have a plan in terms of maybe capacity building back home in Nigeria. But
I've not thought about it yet. If I'm being honest with you,
okay.
I've not thought about it. But what I have started to do right now, I'm writing a book.
Oh, interesting.
Yeah, but it's for physiotherapists who want to practice abroad. I've contacted some of my colleagues who are practicing in New Zealand because when I moved to the UK, I've been able to help a couple of my colleagues to
Hmm.
go through the New Zealand pathway and the Australian pathway. And so I've contacted a lot of them and we've put heads together to compare our practices. So that way we've been able to, well, start writing a book for physiotherapists who would like to go into musculoskeletal physiotherapy. So far, I'm not keen in neuro or pediatrics and the rest, but as an MSK physio, I'm writing a book for them so that when they want to, the the mistakes I made or the mistakes some of us have made, some of us who have moved abroad have made, they don't have to make
Yeah,
those
you
mistakes.
don't
And
make
then
those
when
mistakes.
exactly, and then when they do sit for interviews, it doesn't take them so long to get placements. So
Hmm.
it's still in the early stages though, but I think before the end of the year, it should be out for physiotherapists who want to move. And that being said, I do have a free class where I do teach physiotherapists who want to migrate.
Okay,
Um,
great.
yeah, but let me not say me. Let me not say I do have because a couple of us, somebody in neuro, somebody in pediatrics, somebody who teach clinical governance and value-based questions, and I teach musculoskeletal physiotherapy for
Okay.
free because there are a number of groups out there where physiotherapists pay as high as 60,000 naira for
Wow.
them to
Teach
coach them.
them
Yeah,
stuff.
yeah, coach them, teach them, prepare their CVs and stuff like that. But we do it for free, just as a way of giving back to the society.
Well, that's really great. Kudos to you and your team. Now you
Thank
mentioned, I mean, that you've had to sort of go back to the drawing table, develop yourself, read more books and all of that. Are there maybe specific courses you took, or was it just shadowing, or how did you how did that personal development happen? What are the resources you went to?
Okay, thank you. I think the first thing I did was I needed to know where my lapses were. And I think my main lapses were as a first contact physio, because as a first contact physio, for those who don't know, you work in a surgery or a GP practice close to you, and you work alongside GPs and advanced practice nurses. And
Okay.
what you do is you consult patient. Patient comes in the same way a GP would see a patient. You as a physio would see a patient that way. You have less than 20 minutes to assess this patient, diagnose this patient, document, give them treatment plan, and send them home. If need be, you send them to see the GP, or you refer them for an investigation, MRI, X-ray, or you refer them onward to see the physiotherapist in the NHS, because you don't do any hands-on. You're basically consulting. So
Mhm.
so what I needed to do then was improve my assessment skill, which was really, really lacking when you look at it. Because in Nigeria, of course, I have an hour to assess a patient and then
Yeah,
come up with, but here I have just 20
20 minutes.
minutes, less than 20 minutes to do it. I have 10 minutes because I have to document, I have to teach this patient what to do, teach the patient self-management, counsel the patient, advise them weight loss, or and then refer them. I still have to refer. Oh, hello, doctor. I want to refer this patient to you. I've assessed him. I think he has frozen shoulder. Is going to benefit from some pain medication. What do you think? Or do you think this? What do you think? Or ask the doctor for a second opinion.
Hmm.
So it involves, you have to be very, very good when it comes to assessment. The moment the patient comes in, you should be able to say this is what the patient has. And apart from this, your ability to rule out red flags is key, because many of these patients have not seen a doctor before, and
Yeah.
there are so many red flag conditions that could mimic musculoskeletal pain. Let's say a patient has cancer now, metastatic spinal compression of the spine, and you're seeing the patient for the first time. You should be, for what the patient is saying, you should be able to rule out red flags and say this is what the patient has without, and don't miss that red flag. Because once you miss that red flag, it's something else. The patient who has inflammatory, let's say axial spondyloarthropathy of the back, you should be able to know, oh, this is AXPAR, this is an inflammatory arthritis. It's not
Hmm.
the regular mechanical low back pain. And you
Yeah.
refer onward, maybe to the A&E or to see the GP. So your ability to rule out red flag is also key. All this in less than 20 minutes. So what I did with this was I knew I had to know where I was lacking. And one of the things I did was I paid for a online tutorial class.
Okay.
Yeah, taught by a British physiotherapist, Khalid Maidan, clinical physio. I think I usually pay £18 per month for his class, where he puts you through, he teaches you. Then I also paid for another one again, but I think I didn't really stay long with that. I can't really remember the name. I paid for two of them concurrently. Then I spoke to my senior colleagues. Of course, it's if you speak to your senior colleagues during lunchtime, I talk to the doctors, ask them for their guidance. When I don't know anything, I see the GP. I mean, you have to just be humble, bring
Yeah.
yourself down, ask, and say, look, I don't know this. I saw this patient in this condition. What would you have done if it was you? And the doctor will say, okay, I think that can you send a patient to see me? I think it's so and so. And then gradually I began to learn, especially when you look at right now, one advan one how do I say this? One thing that first contact physios, FCPs do are able to do that Nigerian physiotherapists cannot do, and other specialty of physiotherapists cannot do in the UK and even in Nigeria, is that they can't prescribe. But here in the UK, first contact physiotherapists do have the ability to prescribe and also give intra-articular injections, which
Oh,
was
wow.
something that, yeah, I've not been trained for that yet, but
Okay.
I've been marked to go for the training this year to become an independent prescriber, and my injector cost so I can give intra-articular injections. So not having this training meant that sometimes the patient comes in and say, okay, look, um, I'm on so and so medication, and then you begin to think, what's this medication for, and stuff
Hmm.
like that. So when you and then you okay, look, let me give you a simple example. I had a patient who had arthritis in the knee, and he wanted corticosteroid injection, didn't want surgery at all, was tired of conservative management, tried to lose weight, he couldn't lose weight, he just wanted cortisone injection in the knee. So I I said, okay, good. I would see what I can do. So when the patient left during my break, I met one of the doctors and I told him that I want to send this patient to you for corticosteroid injection. He's on the waiting list for a knee. Okay, yeah, he wanted surgery, but the waiting list is very long. You know how it is in the UK. So he
Mm-hmm.
had a 6 month waiting list. It was on a
Wow.
6 month waiting list. Yeah. So when I met the doctor and I told him about it, he was like, okay, yeah, that's a nice idea. Talk to Dr. Wells about it. So I met Dr. Wells. Dr. Wells, look at this patient and I want to send him to you. I was told that you give cortisone injection into the knee. And then he told me, no, you can't do that because this patient who needs cortisone injection is going to have surgery in 6 months' time. And he cannot have surgery in 6 months' time because cortisone injection, one of the side effects is that it weakens the immune system.
Yep.
So there's no surgeon will touch him with a six six inch pole. So that was
Yeah.
the learning curve. So that was the learning curve for someone like me who is still learning in the role. And
Mm-hmm.
ever since then, I took dressing. Let me put it that way. I took dressing and I learned. So that was how I learned. I think so. Basically, I paid for courses. I spoke to my senior colleagues, and gradually, I'm still learning, but better than where I was when I started.
That's interesting to hear. I mean, because I think a lot of persons, I mean, they share similar stories. You come in, it's like you're a bit confused, but you need to start learning, and you really have to put in a lot of effort actually to catch up to where these people are. And
No, I mean, some people might take offense when I say physiotherapy in Nigeria and stuff like that. But the truth is, if physiotherapy in Nigeria is at that level, if it was at that level, we wouldn't be failing interviews. We wouldn't be paying for classes to pass to come into the NHS. It
mhm,
shows that, and I'm not saying, of course, the fact that we can adjust when we come in very quickly shows how good our, our theory is and everything. But it's still, we still need to build more than where we are.
yeah. So in terms of what do you call it now? Career advancement now. So what is it like? What's the next step? How high can you get?
Okay, well, for me, I'll speak in my role, and I think this is the best role you could practice as a physio. First contact or nothing. Um, it's first contact or nothing. Um, right now, I'm done with my stage two. It usually takes you about 2 years to complete your stage two, and which is testament to how. And this is why I say Nigerian physiotherapy we are still very good. It usually takes 2 years, but I've been able to complete my stage two, my first and second roadmap in 1 year, which normally takes
Wow.
2 years. So I've been faster than normal. I've been rushed, but I've been able to complete my portfolio through my portfolio routes, complete my stage two. My stage three, which is what I was talking about, involves injector courses and independent prescription courses. When I complete this roadmap, I will now become an advanced practice physiotherapist. An
Okay.
advanced practice physiotherapist right now, as a first contact physiotherapist, I'm a band seven.
Oh
But
wow.
as a first contact physiotherapist, I would be a band as an advanced practice physiotherapist. Sorry, I will be a band eight. And
Interesting.
so by the end of this year, by God's grace, if I'm able to go for my course, and I don't think I can finish this year, maybe next year, I should be able to get into the band eight role. So that's it. So first contact band seven, stage one, roadmap stage two, injector course, prescription course. Then you're done with stage three, and then you become an advanced practice physiotherapist. And I think after you do some other courses as well, then you become a advanced practice physiotherapy and enhanced as what's the name? Sorry, extended scope practitioner.
Hmm.
Which is extended scope practitioner, which means you practice beyond the scope of physiotherapy.
Okay.
You begin to do things that normal physiotherapists cannot do. And then I think that's just basically it. That's basically it. In the NHS, they will refer to you as a consultant physiotherapist.
Oh,
Yes, but I don't know about in the GP surgeries how that
translate.
um yes, I don't know.
Interesting. So it's quite interesting to hear that you can come in at a band 7 as a first contact physio.
Yes, but
Wow.
by April this year, that's stopping. They are no longer
Oh,
taking people from Nigeria as first contact physio. I've
why?
written
Why
about
is that?
the Health Education England HEE has said that they don't want the portfolio route anymore. So the portfolio route, which is where I am right now, means I have to write reflections, I have to do case-based discussions,
Oh,
I have to do clinical observation with my line manager and stuff like that. Attend webinars and all those, build my portfolio up.
all those portfolio activities, right?
Exactly, all those portfolio activities, and then you keep learning and learning, and then you have your map where you have to map each of those things you do towards the roadmap, the FCP roadmap. But the Health Education England have said that they don't want that anymore. For you to become an advanced practice physiotherapist, you'd have to go through the taught route, which means you have to go through school. So they've had with an agreement with the NHS and some universities in the UK, with some GPs and some advanced practice physios who would coach the physiotherapist. I think it should take you about 1 or 2 years in school again
Wow.
before you can. So while you are working, you'll be going to school. So you have to combine schooling and working two,
Oh,
3 years, I think. So before you can become an advanced practice physio. So they are stopping the portfolio route this year.
wow.
Yeah. So
That's,
sad news for anybody who wants to come from Nigeria. I made a post about it on my Twitter handle as well for
mhm.
people. Yeah. So if anybody wants to come to Nigeria, this is the time. If you don't make it now, you would have to come and start going to classes like any other person, like a student again.
Wow. So
And I think it
even
does make sense.
mhm.
Yeah, I think it does make sense because when you think about it, I mean, you're seeing patient on a first contact basis. Okay, look at I think before you become a before you become a consultant medical doctor, let me say orthopedic,
Yep,
O&G, and the rest, you will have to go through residency program, which is more tedious. So for
absolutely.
yeah, so for it to become an advanced practice physio, I think it should be more tedious than it is right now, and that's what Health Education England is saying, and hence the schooling.
Interesting. And that means you now get to pay school fees as international students, or
No, no,
how
no,
does
no,
that
no. The NHS is taking care of it, and your workplace should take care of it.
Okay.
Yes,
Basically, you apply, you come in as a physio, but you have to go to school while you're
yes,
working.
while you're working, and I don't think they would like to take anybody from Nigeria because I don't think they would. I don't think they would.
Why?
Well,
Why don't you think
uh,
so?
the people who have been applying, they've been telling them the same thing. Sorry, we're not taking anybody from Nigeria right now
Mhm.
because we are trying to change we're trying the portfolio, whatever, whatever. They keep telling them that they can't take them. So I think, and if you look at it, they want to before you become a first contact physio, you have to have 5 years of clinical experience first. And that's something I didn't mention. You have to have 5 years of
Baseline.
clinical experience yes, as a musculoskeletal physiotherapist. That's before you can get into FCP. And then when you get into FCP now, you start going to school.
Hmm. Sounds a bit difficult now, but I mean,
Yeah.
like you said, the other pathways anyway. So there's so many ways to kill a rat.
There are so many ways to kill a rat. We'll find a way. Nigerians will find a way.
It's really interesting, trying to understand the whole intricacies around how you guys navigate the system, getting into the country, and all of that. So, I mean, what advice do you have for any physiotherapist who is looking to come and join in the UK?
Hmm. What advice would I have for anybody coming to join the UK?
Yeah.
Just study. Okay, know where you want to come into. You want to work as a neurophysiotherapist, you want to work as a pediatric physio, or you have inclined to neuro or pediatric physio, MSK, orthopedics, you know where you want. Make sure it's where you have passion for. Because if not, when you do come, I'm gonna digress a little bit and talk about an example of a
Okay.
colleague of mine I know about who came into the UK as a hand therapist. He was applying for jobs over and over and over again, and wasn't coming through. So he said, anyone wait show, I beg, just apply for this one. Then that one came, only for him to come to the NHS and say, I can't work in this field. Though. It started giving him problems. So he started looking for a new trust he was going to move to. And it was
Yeah.
so problematic. It was so problematic for him.
Excuse me.
And so what I would say is make sure it's a place you have passion for. You don't just apply for the sake of applying. And read, develop yourself. If you have masters in any branch of physiotherapy, good. Stick with it. Come here. It gives you an advantage. And that's what I would say in regards to coming to the UK. Just know what you want and go for it. And another advice I would like to give is, when you come in as a band five, you struggle to adjust. When you come in as a band six, you struggle to adjust. Now imagine coming in as a band eight physiotherapist. Some of
Yeah.
us are some of us are too overzealous. I've seen a couple of people who apply for band eight roles. And I don't know why the NHS is funny in that aspect. Why would you give somebody who has never worked in the NHS a band eight position? It doesn't make any sense. Just because the person performed, nobody's applying for those roles. So two or three people applied. You just wanted to give somebody and you give somebody the role, and the person came
Yeah.
and came to fumble. So I think we need to reduce our expectations sometimes. Start small and then grow.
Mm-hmm.
Start small and grow. You can come in. I have a friend who's a nurse. He came in as a band five last year. He's already a band seven already, and within a year he moved from band six to band seven. So it's
Oh, that's
doable.
cool. I think
Yeah,
I agree with you because it also gives you sort of time or to understand the system, how it works. Because if you're operating at the band eight, it's you're like management sort of. And I
exactly.
mean, they're just throwing you to the NHS, you're new. How do you know your left from your right?
Those guys will chew you out and spit you out. Those guys don't have mercy for anybody. They'll just be looking at you. Are you not a band eight? They expect you to know what to do.
Mm-hmm,
So
mm-hmm.
if my role is unique in the sense that I don't work in the NHS per se. I work in the GP practice alone.
Yeah,
So I don't need to have any apart from clinical skills.
yeah.
But normally I wouldn't apply for any band seven role in the NHS per se. I wouldn't go. I wouldn't try it. I would start with at least a band six
And climb up gradually
and climb up gradually. The truth is, I didn't even know this was a band seven role until I came here.
until you came in. Oh, wow.
And when I came on, I was like, oh, okay. So I just thought they were paying. I just thought the salary was okay. It was just okay, okay. And like, okay, these people they pay well. And like came in. And on my COS they wrote instead of they didn't write band seven. They wrote enhanced band six, advanced band six.
Mm-hmm.
I was like, okay, maybe that's why they were paying well. So when I came in, I was like, although that was, let me just say, that was one way in which they do take advantage of we immigrants coming in from outside the country. And when I came in, I didn't know I was the full band seven, so they were paying me as an advanced band six. I never heard that one before. I don't go lie. They paid me as an advanced band six for a band seven role. So when I came in and I discovered that, all I had to do was prove myself, get my
Yeah.
fitting, get my ground, prove myself that I was worth it. And then I told HR, look, this is it, and this is it, and this is it. And then they gave me my salary increment that I deserved.
Mm-hmm. Well, I
Yeah,
mean, for you to be able to prove your worth, I think they're
yeah.
happy to give you the increase you're
They know,
looking
they
for.
know, they know get choice.
The Nigerians will always deliver anyway. So,
I deliver, though. I deliver. We thank God, Sha. We thank God.
so looking at your other licenses, are you looking to move to Australia or New Zealand anytime to, practice and come back or?
I did think about it recently with the new changes with immigration laws, where Rishi Sunak is trying to make us leave. I was thinking because the truth about it is that I still have 4 years for my ILR, and sometimes I love the UK. I didn't know the UK was this nice until I came in. I was thinking it's going to be one of those stepping stones, and then you move to a different country, either you move to the US or to Australia. But
Mm,
but since I came in, I'm going to be honest with you, I love it here. My family are fine. Well, my wife loves her job as well. Kids are doing okay. My son has started school, so I think
Yeah,
yeah, no, I like it here. But with the immigration laws, I might end up moving if the laws keep changing or if anything just happen. And that's why I just like you said when we spoke yesterday, three-factor
three
authentication.
factor authentication.
If anything happen, I just carry my load and I move. Just today, two of my colleagues got a job in Australia
Oh
as
wow,
physios from Nigeria. So there are jobs. If anything happens, I just pack my load and I leave. And that's one advantage of being in the UK. You keep getting that experience. You gather that experience, and it makes you um gives you a negotiating leverage that
globally.
could be so
Yeah,
yes, globally. I have UK experience now. I have 2 years UK experience. I have 3 years UK experience. I've been working at this level. So I think, and that's why I'm just calm. If nothing changes, if the
you stick
immigration
around.
laws keep, I like it here. I like it here. It's close to home. Before someone from Lagos drives to Abuja, I will get to Abuja before that person. From Heathrow Airport, I did Abuja. 6 hours. I like it here.
Exactly.
I feel I'm just a stone throw away from Nigeria. And I can eat
Omo.
amala, I can eat akpu in the African store. I don't want to leave. Oh.
I mean, these things are they'll probably be in the other countries anyway. I don't know. I've not been to New Zealand or Australia, so I can't say. Let me see.
Well, my sister that's there is let me say I'm finding it easier than she is. So
Oh,
but
really? Wow.
yeah, but the thing is, it's still a wonderful. They are still wonderful countries. They are at the outskirts. There are still Asian stores there. You don't have as many Africans as you have in the UK. Still
Hmm.
wonderful countries. Both countries are wonderful. New Zealand, Australia, they're wonderful countries. But before she come Nigeria, I go take her 3 4 days. Think
To
of the
come
money
back.
for flights. Think of the money for flights. And then when she goes back again, no, now, UK is. And then when you look at it, we have free healthcare here, especially we in the health. We don't pay health surcharge, so we don't know. No,
IHS.
so we know they pay. So for me, it's free. My child is also entitled to 15 hours of school a week. 15 hours of school, yes, a week. So
Hmm.
no, what am I complaining for? It's free healthcare, it's free education. What am I complaining for? There's electricity here. Electricity here. There's
Everything is
good road
there.
here. Everything is there. And where I live is a lot of people talk about waiting list to see a GP in where they
Hmm.
live. I think this is subjective. It's subjective to where you live. Where I live is a white dominated area, and the population is very little. So if I want to see a GP, the other day I was sick and I saw a GP that very day. I called in and I said I wanted the telephone consultation. The reception said no, or was it the reception? The nurse said no. The triage nurse said no, that I must come in. That
You come
this
in.
I should come in. I said me I don't want to go. And that very day, so I went and I saw the GP, I saw the doctor, and I got my medication. I came back home. So when people talk about difficulty with seeing a doctor, I think yes, it does exist in the UK, but then it's subjected to where you live. Where I do live, there's nothing like that. Yes, going into the NHS, the hospital, it's a little bit tricky, but seeing the GPs, your GP practice, it's quite easy. There's no waiting list for us here.
And that's cool. So probably maybe yours is not maybe densely populated area or.
Exactly. So I think when you live in a densely populated area, you can imagine how many people are taking use of or taking advantage of the services of that surgery.
Hmm.
Yes, for me, I live in a very small village and we have a very good GP practice. I want to see a doctor,
Yeah.
you see a doctor that very day. I've never gone there when went there with my wife or my children, and I met many people waiting. The waiting rooms are usually very empty.
Empty.
It's empty. Just walk in, see the doctor, come back out. So I love it here. Oh. I love it here.
Fellow physiotherapists, you people are hearing though. So UK is the place to be, oh, according to Adebola. So
So people want to go to Canada, I should go. You want to go to US, go. Well, me, I love it here.
I mean, talking about Canada, do you have an idea of what the pathway looks like from here to Canada as a physio?
Yes. The thing is, for you to practice as a physio in Canada, you'd have to go through what they call this pathway,
Express
the
entry.
express entry. Yes, sorry. New Zealand and Australia have entered my head. You have to go through the express entry route. Then when you get there you can start the registration to become a physiotherapist to practice. You can't just go straight and practice in Canada. It
So you have
doesn't
to
work that way.
get in there first, then start the registration.
Start the registration process.
Everything about Canada is just different.
It's different. So same thing with the US. You can still go in, write your MPTA exams,
Hmm.
come back and but Canada, that's why I don't even talk about it. If it's not Ireland, UK, um, Australia, New Zealand, it's stressful. It's
But do you have
stressful.
any colleagues in Canada?
Yes, I do. A lady, yeah, she's
Okay.
practicing in Canada. She went there through the study route, which is another route I didn't mention.
Oh,
She went through the study route, and then while studying, she got her license and everything. So it's on that route that physiotherapists could use to go
can
study
I
route.
explore?
If you get the money,
But that
pay
comes
for
at
your
a
study.
serious cost, right?
It does. If you look at how much I spent coming to the UK, to get my license, it didn't. Not now. Right now, to pay for your license cost about over £1 million. When I paid for my license, it cost me 400,000.
Wow, exchange rate, right?
Exchange rate has killed everything. It cost me 400,000 then. But then when I had to come, everything, I spent because the family. I came with the family. Flights. I rented my house from Nigeria because
Mm-hmm.
I couldn't. I didn't want to come and start staying in Airbnb and all that. So I rented
Airbnb,
my
yeah.
house. Yeah, so I rented my house from Nigeria. So I moved straight into my house. So you have to count that into consideration. I paid for my deposits, visa, shopping, and all those other yeah and there. So
Mm.
so it cost a substantial amount of money. But compared to people who go through studies, what am I saying? I can't complain. No, I
No,
really
you
can't
can't.
complain.
You
And that's
can't.
one advantage that we health workers do have. I can't complain.
Actually, we do as healthcare workers. A lot of
Yes,
advantage. Doctors,
yes,
nurses, every cadre of healthcare professional actually have an
exactly.
advantage over every other person who is looking to migrate.
Yeah.
Right. I mean, I'm just conscious of time. I mean, I could keep asking questions all day, but
I can keep talking all day. It's been actually very interesting.
exactly. But I mean, we've got to go. So anybody who is watching, I think you're happy for people to chat you up on Twitter or X now, as they call it. That's
Yeah,
his
yeah.
handle on the screen, and this is his LinkedIn, Adebola Badiru. You can connect with him. If you've got any questions, he said he runs free classes or coaching classes. You can always send him a DM and he'll give you the invite link and show you the way to move like he has done too, right?
Yes,
So any
yes.
final words
All of us
before
must do.
you log out?
Just want to thank you for having me on your channel. It's been wonderful. Someone to talk to. I've not since I started this whole thing. I haven't sat down with anybody on a video conversation. So and I'm very video shy, or let's just say so.
Well,
So
you
coming
don't
here,
look it now.
well, we pretend now. We go try. But it's been wonderful talking to you. Thank you for having me on. And for anybody who wants to come to the UK, it doesn't have to be the UK. If it's New Zealand, if it's Australia, if it's Ireland, which is also a very good country right now, they're so desperate for physios. Physios are on the shortage list, the critical list. They have a critical list.
Wow. Okay.
Yeah, so you can get your PR in 2 years.
Interesting.
New Zealand and Australia, physios are on the A list, a green list, so you could get your PR on arrival. So if
Wow.
those are the countries you want to go to, you don't want to come to UK and come and spend 5 years like us waiting for PR, ILR, then just send me a message. I'll be very happy to help you. But later I'll start to charge you now.
You guys
For
better
now,
take advantage of the free
for
service
now it's
now.
free. For now it's free.
Thank you so much for coming on the show, and thank you guys for watching. And we'll see you guys in the next episode. And bye for now.